Hello, my name is Maras Chowdhury, and today I'll be presenting the current uses and future applications of CT scanning as an imaging modality. CT stands for computed tomography. CT scans obtain images by emitting a series of narrow X-ray beams through the human body as it moves through the arc of the CT machine. The arc moves and captures detailed X-ray images at hundreds of different angles. A special dye called contrast material is needed for some CT scans to help highlight the areas of the body being examined. The data is then transmitted to a computer as 2D slices. The computer builds a 3D cross-sectional picture by stacking these images, the meaning of the word tomography, resulting in a detailed and clear image of muscle, tissue, and bone. There are many advantages to CT scanning compared to other imaging techniques. Due to the penetration potential of X-ray beams and the capabilities of the CT machine arc to capture images at different angles, the resultant 3D image is more detailed and elaborate than ultrasonography, which uses sound waves that do not travel well through bone. While both MRI and CT use tomography, CT scans take almost half the amount of time to produce equally detailed images, a crucial component in diagnosing trauma patients. More generally, CT scanning allows most to all body systems to be scanned through the machine, whether it be a small section of a broken patella in the knee or a full abdominal scan to detect tumors or abnormalities. However, there are disadvantages to CT imaging as well. A portion of the scan requires patients to hold their breath. Patients suffering trauma, injury, or illness to the lungs or surrounding areas may not be able to do so. Additionally, since the powerful X-ray beams penetrate bone as well as tissue, CT scans of the brain may produce images that are disrupted by skull and neck bones. The greatest disadvantage to CT imaging, however, is the large doses of radiation exposed to the patient. X-rays produce radiation that may cause illness in patients, as well as possibly causing onset childhood cancers in children of pregnant mothers. Despite these downsides, CT imaging is widely used in the medical field and has a variety of practical applications. As mentioned, CT scans have a variety of practical applications. Doctors can use CT scans in addition to standard X-ray images to diagnose bone and muscle abnormalities, as the images produced are highly detailed and clear differences between the bone and muscles are able to be seen due to the use of contrast material. In the field of oncology, CT imaging is used to pinpoint exact size, location, and severity of tumors, especially in thoracic and abdominal organs like the lungs, kidneys, and liver. Doctors often request and reference CT scans of specific areas of interest when preparing for and performing surgeries and procedures to guide them and provide them a visualization of the site. CT scans over a period of time allow doctors to monitor whether treatment is effective in reducing disease. We can further explore two areas where CT imaging has been most innovative. Oncology, or the study of cancer, is one specific area where CT scanning is widely used. CT scans can show a tumor's shape, size, and location. They also show the blood vessels that feed the tumor, all without having to cut into the patient. Doctors often use CT scans to help them guide a needle to remove a small piece of tumor tissue. This is called a CT-guided biopsy. CT scans can also be used to guide needles into tumors for some types of cancer treatments, such as RFA, which uses heat to destroy a tumor. By comparing CT scans done over time, doctors can see how a tumor is responding to treatment or find out if the cancer has come back after treatment. One of the greatest areas of CT use is trauma and emergency cases, where time is of the essence. CT scans can be done in as little as 10 minutes, allowing doctors to quickly diagnose and act upon life-threatening injuries. Complex injury, such as traumatic arthrotomies in the knee, are aided by CT scans to help doctors detect small intricacies of the injury, like the presence of intra-articular air that would be difficult to see with just standard X-rays. CT scans are a fast way to view a large portion of the body. Standard X-rays are limited in their size, yet CT machines allow doctors to see entire sections of the body with clear and specific detail. Due to this, CT imaging is an industry standard in hospitals and clinics treating trauma patients. The current uses of CT imaging relies on standard analyzation by medical professionals. But as technology advances and becomes more accessible, the future of CT imaging is promising. Data from CT machines can be converted into code that work with a variety of innovative, capable algorithms. These algorithms will help doctors diagnose illnesses and injuries faster, see images in even more detail, and advance certain areas of medicine like psychotherapy. Modern machines are already being developed to reduce the dosage of radiation exposed to patients, and research into the relationship between CT imaging data and computer algorithms are a hot topic of interest for engineers and computer scientists. Next, we'll explore some of these innovative algorithms in detail and explain their significances. Cinematic rendering is an up-and-coming 3D rendering algorithm that simulates the spread and interaction of light rays as they pass through the body, showing a more photorealistic representation of 3D images than achieved with standard CT. The data for this algorithm is compiled from CT imaging datasets that then model the volumetric data into the 3D figure. The potential applications of cinematic rendering are numerous and varied, including medical education, communication among physicians and between physicians and patients, pre-surgical and pre-interventional planning, early disease detection, and better description and classification of injuries. While this algorithm is still novel, as computers become more powerful and accessible, these photorealistic CT scans may have the possibility to be seen in all hospitals. Deep learning and artificial intelligence algorithms are being developed to help streamline and innovate CT imaging analyzation. In radiology practice, trained physicians visually assess medical images for the detection, characterization, and monitoring of diseases. Artificial intelligence methods excel at automatically recognizing complex patterns in imaging data and providing quantitative rather than qualitative assessments of radiographic characteristics. AI and deep learning algorithms may have the ability to diagnose deadly diseases and cancers before patients have any symptoms and are at a stage where it's maybe even too subtle for radiologists to be able to detect them. Artificial intelligence systems are already being used during this COVID-19 pandemic. Researchers designed an AI-based approach designed to help identify infected patients and quantify disease burden by analyzing thoracic CT exams. Automated CT image analysis with deep learning algorithms has been shown to be effective in detecting, quantifying, and tracking coronavirus. This could enable more patient screening and earlier detection of positive cases to help with containment efforts. Lastly, brain imaging scans may one day provide useful information on the response to psychotherapy in patients with depression or anxiety. Studies show promising initial evidence that specific neuroimaging markers might help in predicting the chances of a good response to psychotherapy, or choosing between psychotherapy or medications in patients with major depressive disorder and other diagnoses. While this is still a new area of research, CT scans of the brain using these neural markers may finally develop an effective solution to treating major psychological disorders. CT scanning as an imaging modality is widely used in the medical field and comes with a variety of practical applications, from cancer treatment, trauma surgeries, and more. Fast image acquisition and clear, detailed images are some major advantages CT has over other imaging techniques. The future of CT imaging is promising, as technology will help diagnose illnesses and injuries faster, see images in even more detail, and advance certain areas of medicine. Altogether, the utility of CT imaging is already advancing advancing medicine and may one day help change the way doctors, engineers, and patients live. Thank you.